Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense.
Welcome back to the Equine Vet Connect. I'm your host, Dr. Caroline Brown. Dan is somewhere today. I think he's fishing. So we're having our girls podcast. I've got Dr. Caitlyn McCaulley over there and our newest addition to the team, Dr. Tori Martin.
Hey guys.
So we are here today to just get to know Tori a little bit, introduce her to the podcast. This is her first time ever on a podcast.
Yes,
you know, we're very professional podcast here. This is a true professional establishment, so no pressure. But
I'll do my best.
First of many. Let's do it.
Well, Tori, why don't you tell us where you're from? You're kind of local.
Yeah, so I'm actually from Georgia originally. So I grew up in the Alpharetta, Roswell area, and then kind of got into horses and all of that around here. So actually when I interviewed with Dan, some of the people that he works with are people that I used to work at their farm back when I was in high school and in college and back here in the summer. So
yeah,
definitely a Georgia native and happy to be back.
Mm-hmm. So what's your journey like getting into vet school? Like what made you want to be a vet?
Yeah, so I started riding horses when I was about 6 years old. It was actually a really funny story because I wasn't actually the one that was interested in riding horses.
Yeah.
So I had a neighbor friend, her name is Sam, and I guess her mom asked my mom if I would do a horseback riding lesson with her because she was scared to do it by herself.
Aw.
And then she didn't ride horses again after that, and I didn't stop.
Funny how that works.
My aunt had a horse, and that horse she had gotten rid of, and he actually was at the barn that I first rode at, so I would get to give him his dinner every time that I was there. He was a little too experienced, or needed too experienced of a rider for me to ride him at that time, but
Yeah.
I still got to interact with him, and it felt like part of family. So I got kind of hooked from the start. And I guess at that point, according to my mom, decided that I wanted to be a vet from that point forward. She says I was about 6 or 7. So I decided that pretty young. Was riding through high school, not any kind of high-level competition, but it's just what I enjoyed doing. And then my first job was at the barn that I initially rode at. So it was at Hunter Valley Farm, and that was my first job, and then I went off to college with the intention of doing animal vet sciences so that I could go to vet school. So kind of never really steered away from that path. I remember having some ideas when I was a kid of different professions I could do, but never really took anything in a different direction than vet med. And so I did my undergrad at Clemson University, and I was on the rowing team there and doing animal vet sciences. So kept myself pretty busy between those two, and I actually didn't get into vet school the first time that I applied. So I got into Ross, but I was interested in doing the military scholarship because that was something that I almost went into the military before I even went to college. And you couldn't do the scholarship if you were at a foreign vet school.
Really?
So
I didn't know that.
I came back here and I worked at a small animal clinic for a year. Actually about a year and a half because I graduated a semester early, and then I got into University of Illinois and just went from there.
Nice. What military branch were you going to go into?
Well, when I was in high school before I went into college, I really wanted to go into the Marine Corps.
Yeah.
My grandfather was in the Marines. I used to ask him to do boot camp as a kid. I remember doing laps around the house and pull-ups and all of that. So I thought about doing that, and I actually had a conversation with my mom, and she said, you know, I support whatever you want to do, but just know that college will be a different experience directly out of high school than it will be after 4 years in the military.
Yeah, for sure.
And the military is always there.
For sure. Yeah.
So I decided to go do the college thing first, and it was like in my first year, my freshman year at Clemson, we had an animal vet science class that they talked about different ways you could use the profession. And so the class each week, we had a different person from a different profession that did a veterinary degree, and basically different ways you could use the degree. And so
there are a million ways you can use it. Jeez.
Yeah. So then when the guy from the Army came in and was like, oh, there's this scholarship program at the beginning of college,
Yeah.
I was like, wow, I like the sound of that. I
Yeah.
can do both.
Yeah.
Now that's through the Army, but I was like, hey, you know, you get a little piece of both. And so that ended up becoming my goal from that.
That's awesome.
Did you end up doing it then, or?
So I applied in my first year, and I was on what they call the OML, so the Order of Merit list. So basically, of the positions that they had, they were able to fill them, and then they had other people that would be good enough to fill the spot, but we don't have all the spots. So you can apply for a 4-year or a 3-year. Well, COVID hit, so when it came time that I could have applied for the 3-year program, they weren't actually doing the 3-year program.
Oh, no.
So that did not work out. I did not end up doing the military scholarship, but I think I ended up exactly where I needed to be.
Exactly.
Yeah.
Exactly.
That's cool.
That is a really good program, though. The military. We worked with a couple of the vets over in Aiken, because they were stationed at Fort Valley, and they're really good at what they do. They're so knowledgeable.
Yeah.
I remember I was literally on my flight down to Auburn to do my vet school interview, and I talked to somebody that was in the military, and they weren't involved in the veterinary side of things, but they were knowledgeable on it, and so we had some really cool conversations about what you can do with it. It's very interesting.
Yeah, I mean, what we do is very versatile. Doesn't always feel that way when we get our head in the mix of everyday life.
Yeah.
but-
There's a million directions you can go, though.
Exactly.
That's awesome. What was the rowing team like? How is it like balancing school and sports?
Oh, well, there were days that it was my favorite part of the day, and there
Yeah.
were days that I was like, why am I even still doing this? The thing I loved about it was like the teamwork aspect, but also you start every morning on the lake.
That's
Like even
cool.
if we're not rowing on the water that day,
Yeah.
our boathouse was right off the lake. So
Yeah.
we're training, or we'd go on runs through campus, things of that nature. So I really enjoyed it. It really pushed me in a lot of ways that I hadn't been pushed before, which was awesome, not just physically, but also like mentally. And I think at times it became challenging with such a rigorous curriculum as well.
Yeah.
But the one time I got close enough to actually thinking I was going to quit the team, I didn't end up quitting.
Yeah.
I had a conversation with the coaches. I was like, this is the point I'm at. They're like, take the weekend off, think about it,
Yeah.
just to let us know what you need. And I ended up sticking around and finishing strong. So it's
Yeah.
definitely challenging, but it's also one of the most rewarding experiences, I feel
Yeah.
like.
I feel like that would be a really cool way to start the day. Like a
Yeah.
nice grounding experience for the the
Yeah,
morning.
until it's the middle of winter and,
Yeah, and you're freezing.
we're in forest. So like I was a coxswain, but I also rowed some, so I did a little bit of both. But when I was a coxswain, and we're in the boats that are the fours, so there's 4 rowers, the coxswain's actually sitting in the bow of the boat. So if we rowed fours in the winter and you get the backsplash on you and then your jacket's like iced over. Like yes, it was South Carolina, but
It's still cold. Yeah,
Yeah.
it snowed when I lived there.
Yep.
So
Yeah, so there's definitely there were definitely some moments that being on the water, I was like, maybe I don't want to start to stay on the water.
Yeah, that's fair.
But I really did love it.
That's
so.
good. So then I know you've had kind of a different path after undergrad.
Yeah.
And after vet school and everything. So kind of where did you go after you left Clemson? Or no, sorry, Illinois.
Yeah, so Illinois, finished up school there, and I knew I wanted to do an internship regardless of what I did after. For me, getting out there and actually doing it, which you do in clinics to some extent, but
Yeah.
actually getting out there and doing it is really what solidifies things for me. So I knew I wanted to do an internship regardless, but during my time at Illinois, I had decided that surgery was really what I wanted to do. I had surgical tech in the large animal hospital, and even when I was working before I went to vet school in small animal, surgery days were like my favorite days.
Yeah.
So I decided that I was going to pursue the path of doing a surgical residency. So I did my first internship at Equine Sports Medicine and Surgery down in Weatherford, Texas, and that was an experience of a lifetime. There were days that it was the hardest thing in the world and why am I doing this? But
Yeah.
it was also, I got so much exposure to so many things, worked with amazing doctors, and, you know, the days that you're stuck there until 1 or 2 o'clock in the morning and you have to be back at 6, like, I don't even worry too much about it because I was enjoying what I did.
Yeah. Yeah.
But after that, applying to a surgical residency, I didn't really get interviews. I didn't get a lot of a lot of
hard.
traction in
Yeah.
that first application cycle, which with one internship I wasn't too surprised by, but
Yeah.
so then with having not matched, I was kind of playing do I try to find another internship, because I applied to some through the match, like specialty internships, but that didn't, like, I didn't match at all.
Yeah.
So I was playing with do I just go get a job and then consider residency later, or do I do another internship? And Purdue actually reached out to me, and I spoke with them. They had an internship position, and I was really interested in research as well, and they took kind of a liking to that. So what they actually ended up coming back with is it was a 50-50 like research and internship position. So 50% of my time would be acting as a normal clinical intern, and then the other 50% of my time I would be involved in projects that different faculty had, as opposed to each faculty getting their own grad student.
Right.
So that's how it started. We had one of our interns leave early in the year, so I ended up taking on like 75% clinical and 25% research, which they gave me the option. They said, hey, this is the situation. If you want more clinical time, you can do it. If you want more research time, you can do it. Like, if you want to keep it how it is. So I decided to take the clinical time because, in the standpoint of, things get set back in research all the time.
Yeah.
Oh, yeah.
And the clinical experience is really helping me grow as a doctor. So that's what felt like the best move for me to do at that time.
Yeah.
Which actually was a really good move, because one of the projects I was supposed to be on, we were waiting on another institution to finish up, and we never actually got around to doing that project.
Dang.
So
Yeah.
I feel like that's the epitome of doing research.
but I'm really glad I didn't keep a 50-50 with that, because had I still been 50-50, there were times on research where I had done a bunch of stuff with one of my papers, and then I was like, okay, but I'm not in the midst of my other project.
You're at a
so
standstill.
I was trying to figure out, okay, well, what can I make progress on while I'm waiting on
Yeah.
other things? So it ended up working out really well. I applied for surgical residency again. I had, I think it was 9 interviews this time around.
Yeah.
So
Wow.
I was like, okay,
Cool.
I'm getting somewhere.
Yeah.
Yeah.
People are paying attention. I went to the ACVS conference and, met with people, talked with people, and sure enough, I still didn't match. So
Well, because with the match, you have to rank them the same, right? So like if say you rank somebody number 3, you also have to be number 3 on their list. Is that how it works? Or it's like,
it's so complicated
Yeah.
that even trying to explain
Like,
it,
the algorithm
I probably messed
is-
something up.
yeah.
But
It's really
what
difficult,
was really
though.
interesting
Yeah.
about this year is, from what one of my mentors said, is it sounds like all of the programs got their number 1 choice this year.
Really?
Which it's supposed to be, in theory, it's supposed to be in favor of the applicant.
Yeah.
So like every applicant puts their, everybody puts their ranks, and then every applicant is essentially like put next to their number 1 choice. And then let's just use Purdue as an example, because I did my internship there. Everybody that ranked Purdue number 1 is in a pool for Purdue to rank, basically.
Oh, okay.
And then it moves down the list.
Okay.
Is how it's written, that's the theory behind how it works. So yeah, just didn't happen to work out in my favor. And
Yeah.
so then I was, back to the decision board. Do I really push for another internship to try to do something to continue that, like push towards the residency, or do I get a job? And I actually had someone reach out about an internship that they wanted me to do that was surgical. And
Yeah.
as much as I really appreciated that thought, I had pretty much decided well before I went into the match that if I don't match, I'm going and getting a job.
Yeah.
I know people that have done an internship, a couple years in a job, and then gotten the residency. So for me, residency is definitely not off the table.
Yeah.
But I also want to use the next couple years to see if I'm happy without being a surgeon.
Yeah.
Yeah.
Because we can still do surgery.
Oh,
And
yeah.
that's
Oh,
the coolest
yes.
thing
Yeah.
about this job is we can still do it. Yes, in the equine world, a lot of people seek out surgeons for certain procedures, but
Yeah.
that's one of the reasons, one of many, but that's one of the reasons I really was excited about coming here, because of Dan, and
Yeah.
he's all for doing
Oh, yeah.
surgery. He
Oh,
went
yeah.
and did arthroscopy training. If I asked him to do that, I'm sure he'd put me
Oh
through
yeah.
it.
He's
So-
game for continuing education, and he's
Yes.
game for you. If you want to do it, he will support it and let you do it. So,
Yes.
Right.
Yeah.
So I'm, kind of hopeful that I just find my spot here, and
Yeah.
I'm able to grow in the ways that I want to in different directions, and
Yeah.
can kind of become the clinician that I wanted to be as a surgeon, but without
Yeah.
having to do the residency game.
I think too, there's a lot to be said about work-life balance in this practice, and just, you know, being able to have a life and actually make a living and
Yeah.
and all those things, and still get to grow and do the things that you want to do. Like, I think that's huge. So I hope that it's we're excited to have you. So
Yes.
Yeah.
I'm excited to see, you know, what you do and what you bring to the practice, and I think it'll be good.
Yeah. So what, I know you've said surgery, but like what's your kind of like, what's your dopamine is what I call it. Like,
Yeah.
you know, what do you get excited about?
Yeah, so for me, really the like sports med, lameness side of things, and then surgery tying to that. So not that everybody considers like a nasty laceration a big surgery, but like nasty lacerations, nasty joints, whether that's OCDs or septic joints
Yeah.
or things of that nature. I actually really enjoy airway surgery.
Really?
We did quite a few tie forwards, and I found those really fun.
Interesting.
And it's also just really exciting when you can take an athlete, like having been an athlete,
Yeah.
which I wish I was still as athletic as I used to.
Right.
I got to get back.
I feel like we all say that.
I ran a mile. I ran a mile 2 days ago.
there you
and
go.
I'm so sorry. But it's like my dopamine, as you call it, is taking a performance horse and getting them back to performance.
Yeah.
Whether that's getting them back to the level that they were at, or getting them back in after an injury that has removed them completely from their activity.
Yeah.
That right there that's what gets me going,
Yeah.
because I connect with that, I relate to that. I also really enjoy like foals.
Oh God.
And so like angular limb stuff, they're really straightforward surgeries in most cases, and I don't know, you make
it better.
It's all
Yeah.
angles. It's
Yeah.
it's all
It's
like
all
it's
angles.
geometry. It's
Exactly. So I don't know. I really enjoy taking something that's not at the level that it needs to be and getting it back there.
That's
Yeah.
cool. That's awesome. And it takes a very, you know, specific type of provider, I think, to do that, because like that can be such a long, frustrating road.
Yeah.
And, you know,
Well,
that's,
and it can be a bit of a treasure hunt sometimes.
that's true.
Yeah, because we talk about it all, like I talk about it like a puzzle, and like a lameness sports med puzzle is very different than like a medicine puzzle.
Yes.
And so it takes a different kind of person and a different kind of practitioner to be able to piece those things apart and enjoy it. So it's, we all have our niche, and it's good though. Yeah, it's good.
Yeah, I'm excited to hopefully start getting some of that kind of clientele, and
Yeah.
getting these
There's
cases that
enough
I
of
can
them.
follow.
Oh, you got
Yeah.
Because the thing too is when you're working with an athlete, like it's not just when things are going wrong, it's also
Yeah.
maintaining them in their sport. And
Yeah.
so being able to start to gain some of these clients and patients that are really working at a high level is going to be really exciting to follow those stories and,
Yeah.
and their journeys as
Yeah.
athletes as well.
Yeah, it'll be good.
Yeah.
We've got a lot of horses that'll be excited to see you, and it's yeah, it's gonna be good.
Yes, and we've got lots of disciplines here.
Yes.
That's like one thing I really love about this area is we have a very diverse clientele here. Like
What do
we've
we
got
say?
the
Donkeys to dressage.
donkeys to dressage. So I mean, yeah, we see all the big major disciplines, and then some of the smaller ones. We see the backyard things. We see the high level performance guys that are here, there, everywhere this weekend.
Yep.
I mean, we see the old, the young,
Yeah.
the 3-legged, the 4-legged, sometimes 2-legged.
Yeah,
But we love them all.
Yeah.
We love them all. And we love our
sure.
clients.
for sure. You will be busy.
Yes.
That's what I like to hear.
Yes, you will
Yes.
be busy. I think, coming out of internship and coming to this practice, at first I was kind of like, I have free time. Like, what do I do with free time? I don't know how to do that. But I think, once you kind of hit your stride and you get your client base going, like, it's very rewarding, this practice. It'll keep you busy and challenge you, and it's good. And you always have the support system of everybody behind you too. So
Yeah, I think the biggest thing for me that's going to be an adjustment is, well, one, it's also getting used to, you're on the phone with someone, they're like, well, what's that going to cost me? Or
Right.
how does that, and I'm like, I don't actually
Right.
know yet. But I think
Yeah.
I think the biggest adjustment for me in a good way is going to be actually stepping into being the final say and not being like, oh, well, I need to get this information to see what Caitlyn thinks or see
Yeah.
what Dan thinks.
Yeah.
And be like, okay, well, what do you want me to do with this? Like, it's not what do you want me to do with this
It's
case?
what do
It's
I
what do
wanna
I
do?
want to
What
do
do I-
with this
yeah.
case?
Yeah.
And so, I'm fully confident, ready to do that. I'm just not used to not having to report to somebody else.
Yes.
So
Yes.
it's going to take breaking that cycle of just innate, that's been my routine of,
Yeah.
okay, I know exactly what I would do, but
I gotta get it
somebody
cleared.
else gets, yeah, exactly.
Yes.
I've got to get it cleared.
Yeah.
So I'm anticipating that being an adjustment.
Yes. We still definitely you were here when we were talking about cases on Friday. Like
Yeah.
we still definitely bounce things around with
Oh,
each
of
other
course.
and are like, I could do this, but do you think this would be better? Like we still definitely do that for sure. But
No, of course.
it is an adjustment to come in and make the decisions and call the shots.
Yes.
Like it's an adjustment.
I feel like for me too, one of the biggest transitions was long-term case management.
Yes.
Because when you're an intern, you see something for whenever it's there, but most of the time once you send it home, it's gone. It's one of the other associates would kind of take it over, and we wouldn't get to continue this long-term follow-up, and
Right.
or if you did, you couldn't really be 100% in it because you're so busy doing everything else. So
Oh, yeah.
I feel like I've been here for almost 3 years now, which is insane. But I think actually this week is my 3 years.
wow.
But yay.
Go you.
Yeah, I know, it's crazy. But I have cases that I started like within my first couple months of practice that I'm still working on.
Yeah,
which is awesome.
And it's just cool that, I get to see this growth of, not only the horse, but just my relationship with the client too. Like,
Well, and you get familiar with the horse. Like there are so many times that I have in my career so far, as an intern even, that I'm in a situation where it's like your horse better than I do.
yes.
So even if I'm not seeing something right now, like your horse better than I do, and I feel like when you start getting that longer term follow up, then you really start to know that horse as well.
Right.
So those subtleties are things that
You can pick
you
up
start
on.
to pick up on.
Yeah.
That may make your diagnostics and your treatment of a case more efficient.
Yeah. Yeah.
For sure.
Yeah,
For sure.
And that's that building that veterinary client relationship. I think that
so important.
Yes, and that's where that's the one thing I've loved about private practice. It's just getting to do that and having those connections. Because the intern life, the residency life, it's just go the whole time, and you do get
Yeah.
some of that, but I feel like it's so much more genuine here,
Yeah.
and getting to do that. And I think I'm hoping you found the same, rewardingness from that. I mean, whatever you want to do, if you want to go on to residency, like go you, awesome. But I
We'll
hope
see.
I hope
We'll
you
see.
I hope you can enjoy that part of it, because at least I know for us, like that's been like the thing that kind of keeps me going with
Yeah.
this practice.
I feel like there's a lot of appointments where, I go there and I treat the horse or do whatever I need to do with the patient, but then I spend, an extra 20, 30 minutes just chatting with the owner
Yeah.
because we're catching up because I haven't seen him for 3 months. And it's just those kind of relationships that we foster a lot here, which is fun.
Well, and I think back to like being an extern even and different interns that I worked with, and I mean, shout out to Dr. Fischenfeld out in California, but Chelsea and I became good friends when I did an externship out at Loomis Basin
Yeah.
in California, and just seeing her do an internship, become an associate about 6 months after she started her internship, and then just carrying on and growing as a doctor. Like, I watch her growth and her journey and how, like, what she does every day, and man, like, I don't know somebody that works harder, and
Yeah.
seeing all that she can accomplish. And she didn't do any kind of residency. She's not any kind of specialist, but
Yeah.
she's she's doing chiropractic, she's doing all of this stuff.
Yeah.
And I'm like, wow, like, I don't necessarily have to do a specialty to become specialized in certain things.
Yes.
You, you don't need a board certification to become an expert at something.
Yeah.
Correct.
You don't need the letters
So.
at the end of the day. As
No.
long as the only limitation is, what you think yourself is capable of. And,
Yeah.
that is the really cool thing about this profession is you can go and learn anything.
Yes.
Yeah.
The CE these days is unreal. Like
Yeah.
just the
And it's
the
so
things you can
important
do.
to invest in, which is something I love about Dan, because he's made that very clear that he's here for it.
Yeah.
If I think that it's going to provide value to my practicing, then he's game.
Yeah.
Yeah.
And I think too, like, the thing that really drew me to this practice when I started was the doctor's meetings that we have every week, and, you know, bringing a paper every week, and, you know, having these kind of little mini CE sessions with all of us. And I like to learn, and I'm excited to have somebody else to bring another perspective in and bring some interesting papers for us on Monday mornings. It'll be fun.
I still have access to a subscription to equine surgery.
Nice.
So
Nice.
you guys will have to
Yes.
probably listen to a few of those things here
That's
and there.
all good.
But I'll try to keep it practical to what we actually do.
Yeah. Yeah. We go off the wall sometimes.
We do,
we go
yeah.
off the deep end.
There's as you saw on Friday, there's a lot of just powwowing and you know, throwing ideas out and
Dan staring at the wall, and you think he's not listening to you, and then he all of a sudden just turns around and drops this diagnosis, and you're like, oh my gosh, that's right. You're right.
yeah. If you ever see Dan staring at a wall, he's not ignoring you.
He's not. He's just thinking.
He's thinking.
Yeah.
That's his thought process.
He's doing some really good thinking.
He was doing some really good thinking, that is for sure. He was definitely needed his brain at that point.
Yes.
But yeah, it's good. And I mean, I do think you'll be a good fit for the practice and for the clients. I think it'll be fun.
I'm super pumped for
Yeah.
it. I'm just ready to hit the ground running. And
Yeah.
Not have an end. Just keep it turning.
Go for it.
Yes. You'll love it.
Yeah.
Again.
What do you like to do in your free time? If you have any.
That's a great question.
A pending answer.
So I feel like a lot of things that I really used to like doing, I haven't done in a while. Like I used to love working out, but I also didn't work out a ton, had some injuries, and when you're not working out and you have injuries and you don't really rehab them, like getting back into working out is a very struggle. Like my run,
Yeah.
1 mile, like 11 minutes, and I'm sore from it.
That's okay.
So
okay. It's a start.
It's really a process of getting back to those things.
Yeah.
But I do love to cook. I like to be outside, work out, hike, things of that.
Yeah.
I'm really excited to be back in Georgia because whether it's Georgia or South Carolina, there's a lot of great hiking. And having been kind of stuck in the Midwest, or in Texas for a year, then back to the Midwest for the last 6 years, there's not as much of that. So excited to get back to some of those things. You guys are both Midwestern.
Yes.
We are. We're
Southern
transplants.
I highly recommend people to live here, but I told myself I wasn't going to run back to Georgia, and
Yeah.
here I am. You guys snuck me back.
So I guess kind of wrapping up, what's a defining case for you, like that in your career that you're like, this is where I need to be, like this is why I'm doing this?
So actually, there's a case that it unfortunately has a bit of a sad ending, but there was a case that was actually a 3-month-ish to 4-month-ish old foal that had been out in pasture since she was born, like had never been handled, that came in and had a luxated pastern.
Oh.
So we did a pastern arthrodesis in a foal, and I learned so much through that case because, one, I basically halter broke her. But two, she was in hospital for a really, really long time. Like there was a time she was going to go home, and then they didn't want her to go home until she was like 100% out of bandages and all of that.
Yeah.
And a pastern arthrodesis, we think about that in adults, and yeah, it's a pretty major procedure, but they tend to do really well. And so I had a ton of questions for the surgeon I was working with on, can she be a performance horse? This horse is supposed to be a barrel horse, like had really great lines. And he was like, yeah, no, she can absolutely do well. Unfortunately, she had some complications. She also was not always one that wanted to be quiet in her stall, so that may have contributed to some. But having that horse in hospital for so long and getting that horse comfortable with me, like she wouldn't behave for other people.
Yeah.
But I could do her bandage when we were in a light bandage. I could do her bandage without even having to give her any sedation.
Yeah.
Because she would tolerate me. And so just following a case like that unfortunately had a poor outcome, but was such a light bulb of, wow, we really can do major stuff at a young age and they can still grow up to be performance horses. Like that's a horse that will always stick with me.
Yeah.
Yeah.
I feel like it kind of blends a couple of things that you like too, like foals
Yeah.
and then surgery
I love their little
and
personalities.
performance. Like, yeah, it's a cool case
Yeah.
for sure. Yeah.
So she will always stay in my book as a case that I remember.
Yeah.
But-
Those cases that you have for a long time that you do have to interact so heavily with and you bond with them for a long time, like those definitely stick in your brain for sure.
Especially, I feel like it's one of the things I hear is, it's so hard to lose a patient. And yeah, it is. But, a lot of times it's, well, what did that patient teach me?
Yeah.
Yeah.
And, yes, we lost the one, but I've saved dozens more
Yeah.
because of that one patient.
yes.
And, it gives it some meaning, I
For
think.
sure.
So
For
Yeah.
sure.
Yeah.
that's
always,
awesome.
Always a learning experience for sure.
Well, this is a fun podcast, you guys.
Yeah.
This is cool. So we're excited to have you on board, Dr. Tori. If you see her out in the field, say hi.
Yes. Say welcome.
Welcome, and be nice to her, please.
Yes. We are excited to have you. I think you'll be busy and just rocking and rolling in no time.
Yeah, I'm super excited to be here. So grateful for you guys taking me on and looking forward to seeing what great things we can accomplish.
Yes.
Absolutely.
And you'll see her on the podcast more too. She's
Yeah.
going to be a recurring,
I'll become
a recurring host.
professional.
Yes. We're always, again, this is a very professional podcast, so
We're legit.
we are legit. We have microphones and headphones now. I want to get a green screen, but
I think that would be fun. We
think-
got to change up the background a little
Yeah.
bit every now and then.
we're like, oh look, we're outside. Oh look, we're in the barn.
Countryside, beachside.
Countryside, beachside. So coming at some point, maybe one day.
Oh, gosh.
We'll look into it.
Yes, we're looking into it.
Cool. Well, thank you guys for listening. If you have any questions for Dr. Tori, you want us to pick her brain a little bit more, send those in. If you have other topics that you'd like us to cover, we are getting to those as quickly as we can. But thank y'all for listening, and I hope y'all have a good day.
Bye, guys.